Dear friends, I am happy to meet you once again this Saturday. A great day for me because today is Saturday, 17th August 2024. We have finished so far 1447 cases of Puberphonia. So today also we have made a collection of 200, 100 cases, one bundle, another 100. So we are going on aggregating the cases. Every case we are recording. Every case we are taking photograph of vocal cord, uvula, how we are doing. So every case is recorded. So in future also, if in our many articles, but still, if I want any other thing also, or some new ideas, because every day in Puberphonia I am getting the new idea. That is why we are able to you and present to you how we are recording the Puberphonia. Every case we find out the frequency and take a record in our lab and make it permanent for them. Then only we do the things. So along with that, recording the voice. See, Puberphonia, it is not a simple procedure that we all has to understand. That treatment is not a small thing. It is not one day. So now I have already we have presented 10 articles in national and international journal. Now I am preparing another article. This article, every night I am enjoying, I am recollecting what I am doing. So, Puberphonia treatment is not just one day treatment. It is a vocal rehabilitation. We are not doing a speech therapy at all. We are not teaching a new voice. Already they are having it. So that only we are bringing forward to them. So it is a vocal rehabilitation. It is a rehabilitation program. It is not one day program. In our place, we are doing it for 5 days continuously. From morning 11 o'clock, 10 o'clock, usually the boys and sisters will come and start the training. It will finish only in the evening 6 to 7 p.m. And added to that, it is a group therapy. So such a wonderful thing we are doing, and we are able to get a good response from the treated boys. And they are thinking they got a good treatment, good accommodation, good friendship. That is the main thing. Now my 11th article on Puberphonia. I am preparing, that's all. But how much I am enjoying in preparing this research original article. There are 10 other new articles are there in my mind. I am here want to tell one small thing. Professor Mohan Kamesaran used to tell me, whenever he do one cochlear implant, 10 cases are waiting for multivarious reasons. So one operation means 10 other cases are just following, waiting for surgery. This is what Professor Dr. Mohan Kameshwaran used to tell me. So today, if he is doing one case, another 10 cases just waiting. He is planning what to do for other cases. But every case is not similar at all. It is not ditto. All we have, even though they are having congenital hearing problem, their finding will be entirely different one from other. So similarly, what I am seeing, how I am treating the puberphonia in my mind every day, night, I am getting new idea. So this article, within 1 month, I hope I will finish this article. It may take 1 month. All the things, records I am having, because this is not today. This is for 15 years record. I'm just reading book, comparing with the other treatment, comparing with the other articles. Because God had given me a lot of rest time for me to read. Reading, writing, typing. So this had given me now a new idea how to present it. It is puberphonia is basically not one day treatment at all. So I am going to present a comprehensive vocal rehabilitation program for the treatment of puberphonia. So a comprehensive vocal rehabilitation program for 5 days. Basically, vocal rehabilitation is the main treatment. It is a main treatment option in case of puberphonia. And it has the purpose of enhancing the quality of voice production and voice related life aspect. So that is what I am going on repeating. Treating puberphonia is not simply treating voice, giving another life to them. So our program also enhancing the quality of voice production and voice related life aspects. And minimal effort has been made to offer a clinical practice that is based on evidence, including the development of specific therapeutic protocol for treating puberphonia as an option for clinical and scientific improvement. So it is necessary to define the focus. It is necessary to define the object of the puberphonia treatment and the type of approach and the duration in order to establish the intervention and criteria. So it is a good paper. My 10th paper will be a very good paper, research paper. So I had the experience of 1,447 cases of puberphonia, and we have given the name as Kumaresan puberphonia remedy. So this is a very big, great opportunity for me. The word is coined by Nanjil Nadarajan. So I am just following it. What I am speaking, writing, and giving the presentation, all the things will be in the name of Kumaresan puberphonia remedy. That concept. With this approach in my mind, Kumaresan puberphonia remedy, I got success in giving the world, yes, voice index, that Kumaresan Puberphonia voice index we have given. So slowly, I will be able to give more insight in the treatment of puberphonia. So now I have charted a program for the treatment of puberphonia. It is already I have told you. So it is not simply one day program. The treatment program itself for 5 days. So it is a combination of ENT surgeon and then rehabilitation with voice training specialists. It is not speech therapist at all, because I am going to tell what are the things important in treating puberphonia. Number one, we have to improve their breathing capacity. So how to improve the breathing capacity means we have to improve their abdominal breathing. So that itself a big training for ENT surgeon or voice puberphonia voice rehabilitation program therapist. They should know how to give a abdominal breathing. You can say it's a diaphragmatic breathing, but more precisely, I want to tell this as abdominal breathing. So it is not a diaphragmatic breathing. So we should be able to aim to give abdominal breathing, adequate breath support that I have given, and find out our own method of doing so. How to give a abdominal treat puberphonia. Simply anybody can say, do abdominal breathing and start the speech. You have to do abdominal breathing, abdomen should move, diaphragm should move, and your speech also should coordinate with that. How it is possible? So that we have created our own idea, and happily we are doing it. Not only like that, we will ask the puberphonia boy to continue the abdominal breathing for 21 days in their home also. So that is a big concept. See, this we have taken it very seriously. See, as a voice, we should improve and do the correct pitch. That is the first and foremost treatment for puberphonia boys. They are worried about the pitch only. They pitch, they will interpret as high pitch. They will interpret as child voice or lady's voice or immature voice or breathy voice. We know we will be able to measure the pitch. So we should be able to give a correct pitch to them. What is meant by that? We can simply say you should have a correct pitch. Similar to abdominal breathing. Do abdominal breathing. How to do it? We know our own technique. That we will be able to tell in this original research paper. So second point is correct voice pitch. It should not be high or low. The basic fundamental feature is high pitch has to be converted into low pitch and it should be standardized. So pitch memory pitch should be we have to make it as a memory for him, the puberphonia. After improving the pitch, that means high pitch to low pitch, they should memorize the pitch memorization. A great amount of research in there, then we have found it. And we'll able to make the pitch. This is just like cricket player. How is the pitch? That is the basic ground. Now everybody know in cricket, the playing pitch of the ground. So the audience enjoyment directly responsible on the pitch. That is why they are spending lot of money, lot of time, lot of concentration. The pitch making people are great. So that we have found out how to give a good pitch for puberphonia boys. Number one is breast support. Number two is pitch. How much you will be able to give. How you make it the pitch as a memorable one. That is the important things. Then focus on tone. Is it too nasal or deep throat? So it is a brand communication for you with the audience. Tone. Yes, Dr. Kumaresan is now giving a talk. That tone should be there. It is a brand ambassador of your voice. That we are able to give. How good, great, happy. Every day my research, I feel so happy. Tone focus means it is a brand for me, brand for your business, brand for your communication, brand for your success. So similar, the same thing for puberphonia treatment. So the tone focus is very important. The next thing is voice quality. Is it holds? It is breathless? It is a nasality? Or tone is different? It should be the tone should have a high quality of tone. So that is very, very important. How the quality mean? The quality should not be breathless. The quality should be flexible, strain-free, and it should have a expressiveness. So how much the quality. So that I am concentrating in treating the puberphonia. Then the rate in voice. The rate of the speech should not be fast or slow. If we speak to the audience, they should be able to follow it. So you cannot speak so fast, then the audience won't be able to absorb what you are telling. If you speak too slow, the audience also lose interest in your talk. So both way, we should be able to correct it and make it to a pleasurable speech. So volume you have to control, then the rate at which you are talking it should be controlled. All with this addition, you should have the knowledge of vocal hygiene and communicative behavior. So this will take a 5 days. A continuous intervention of 7 days therapeutic session should be there. So 5 days you have to continuously monitor them. First day you are getting the voice, but the second day it need not be the same voice. So we have to get the correct, not simply changing the high pitch voice to low pitch, but what are the things involved in it we should be able to make correctly, and they should be able to understand their pitch, breath support, tone, quality, volume, and this should be there in their mind along with the rate in which they are able to talk. So these are the things you have to practice, make a practice. Okay, this is about the voice. The puberphonia problem, not simply with the voice, but their quality of life also should be changed. For that, what we are doing, it is a big program for 5 days, even the virtual reality treatment. In virtual reality treatment, your worriness can be made all right. Your depression can be made all right. Your thinking of unwanted thing can be removed and you can be a fresh person. So all these things you can get by virtual reality. So that we are able to do it. In our mind, we know puberphonia is not a disease at all, but it is a speech problem which may lead to many socio-economic problems. So our treatment is focused in that angle. In puberphonia, the child voice continue intentionally or unintentionally in adulthood. The voice in puberphonia is mostly interpreted as female voice. Knowing and recognizing the inappropriate voice, they try to modify the voice, which result in various quality of voice and destroy their image. I hope you will be able to understand. They will have their child voice, which is not broken, which is interpreted as female voice. Okay. But they will try to understand they are having not a adult male voice. For their adult caliber, they are not having the appropriate voice. They recognize this inappropriate voice. So they recognize it. They themselves try to modify the voice which result in various quality of voice and destroy the voice and destroy their image. This puberphonia needs correction. It cannot become normal without treatment. So fundamentally, larynx is normal, vocal cords are normal. There's no problem, there's no growth, but the voice is not only changed. So it needs only voice rehabilitation. We are able to do it successfully and treated. Until today, we are able to treat 1,447 cases of puberphonia until today, 17th August 2014, 2024. So this is a great opportunity. Having that, I just want to present my 10th international paper on puberphonia is voice rehabilitation program, a road map for treatment of puberphonia. With this, thanking you. I'll meet you next Saturday. Great, happy, happy, happy.